You're listening to KX 93.5, Laguna's only FM. I'm Scott Hayes. This is Radio Caravan. And in the studio this morning, of course, we have the lovely, healthy lifestyle coach, Miss Jill Harvey.
Good morning, Jill.
Yay, good morning.
Good morning. Who's here to talk about anti-aging foods because in honor of our guest, Lester Lee, Dr. Lester Lee is here to talk about the anti-aging process.
Right.
Yeah, so take it away, Miss Jill. Take it away.
So, as we're going into the anti-aging theme, you know, we're aging better than ever before. We're living longer, and there's a lot of research out there.
I can't hear you. Can you please speak up?
You can't.
What?
No, his aging, his hearing.
Oh, jeez, really? I was thinking you can't. All right.
Go.
All right, so we... Where's that little machine? So there's more research that's continually shedding light on the power of foods in this process.
Yeah.
And again, you know, a lot of disease that happens is at our own hands, right? And a lot of the aging, you know, if we're eating foods that are inflammatory or are, causing inflammation and releasing free radicals, we're going to have a harder time. We're going to have joint pain.
Right.
So, you know, aging can be a beautiful thing, though, as well. You
Sure.
know, if you have a sense of humor with it. So, you know, with this anti-aging thing, I like to think of not aging, but growing more whole, because we gain more wisdom, we become more peaceful in our life.
Many
and
people gain more weight, too.
Yeah, that's true.
We're going to talk about that,
Okay.
right? Yeah. So, and, you know, we just have to be a little more open to the process and not be paranoid of it, but know that there are medical and science and nature meeting to really help us battle and feel the way we're feeling and look the way we're feeling.
Great.
So, yeah.
So anti-aging foods, what do we
So
got
we
going
have
on
these
there?
foods. They want to be rich in antioxidants and fight free radicals and oxidation and inflammation in the body.
Right.
So we're looking for foods that are rich in your antioxidants C, D, E, omega-3s, and have phytochemicals and phytonutrients in them.
I'm not even sure what that means, but it sounds
well, these
interesting.
phytochemicals
Sounds
and
tasty.
They are tasty.
Yeah.
Phytochemicals and phytonutrients are really your non-animal food-based compounds.
And what is
within
like
plants.
a free radical? Is that like when Jane Fonda gets out of jail? What
There
is
we
a
go.
free radical?
Well, I am not commenting on that.
You're not?
No.
No?
I'm not going
No
to
Hanoi Jane
diss
jokes?
Jane Fonda on here.
But what is a free radical for
So
our
a free
audience?
radical is just something that is floating around and stealing electrons and damaging other cells. And when that happens, the cells aren't efficient. And, you know, our cells make up tissues, they make up organs, and the whole, you know, process of being human. So we want to kind of battle that.
Okay.
So foods that help to protect ourselves are sorts of berries, all sorts of berries. Blueberries, raspberries, goji berries, golden berries, strawberries.
I love
Do you know
berries.
they call blueberries brain berries?
I did not know that.
Wow.
Well, there you go. So these are good for our brains, our vision, our nerve health.
How about dingleberries? Are those good?
Yeah.
You know, those are good for nothing.
No.
Yeah, except for jokes. Yeah.
Yeah.
Not even that.
Yeah, now,
good
you
for
know, now
jokes.
I'm nauseous. Now I'm nauseous.
Sorry,
Thanks. Yeah.
sorry, apologize.
And then we have tomatoes, and those are rich in lycopene. And, you know, that is one of the vegetables that cooking actually enhances its nutrition value. So we like those. And it also provides an internal sunblock. So that's Dr. Jessica Wu really has this book out on, you know, foods to help you age well and
Right.
take care of your skin. And then we like all the squashes, the acorns, the butternut squashes, the spaghetti squashes. And those are the orange color, so they're rich in beta-carotene. We like that. And then we have your salmons and your trouts and those fatty fishes that are good in your omega-3s.
Beautiful.
Right?
Yeah.
We love those. Our whole grains, high in fiber, and they help to you know, reduce the risk of any digestive disorders, type 2 diabetes. It slows down the digestion process, so it really helps that insulin reactivity. And
Where
then
do we
yeah.
get those whole grains from, by the way?
We
Which
can have
foods?
them from quinoa. We can have
Okay.
them from oats. We can have them from brown rice.
Gotcha.
But not your white flours, not your processed foods. Those are very inflammatory and damaging.
Okay.
And put the weight on.
Okay.
And then we have your cruciferous vegetables. Do we know these?
This is a family show.
Oh, yeah, sorry.
What are those?
Well, these are the sexy vegetables, the Brussels sprouts, the broccoli, the kale, the cabbage. And those are really rich in your phytochemicals, your vitamin K, and calcium. So we really do like those. And then the avocado,
I love
which is really
the
a fruit,
avocado.
right?
Yeah.
We love that. So eat more of that. It's a good monounsaturated fat.
Okay.
And it's kind of like the fat similar in olive oil.
Yeah.
And then we have your lentils and your legumes. And those are fantastic. They're high in fiber. They help to balance and stabilize blood sugar.
You eat Legos?
That would be legumes.
Oh, legumes.
But I'm sure Legos can be tasty dipped in chocolate.
Anything in chocolate, if you like chocolate.
And then your phytoestrogens, they have a lot of those. And those are similar to the natural estrogens in the body and help fight menopause and andropause, what men go through.
Oh, yeah.
So so I think, you know, again, to wrap it up, you know, most important is having a good outlook on life, being playful, being fun, laughing,
Yeah.
You know, I refuse to grow up.
So let me ask a quick question here, and thank you, by the way. Very
Yeah.
succinct and very informative. If I were to start eating these types of foods,
Right.
would I really notice a difference?
Yes, you really would.
I really would.
If you eliminated the other foods that are very
Yeah.
inflammatory, the sugars and the white flours and the
Gotcha.
processed foods, and you increase your hydration, you would notice a huge difference. And coupling that with exercise and
Please.
movement,
Yeah.
you know.
Wonderful.
We handle everything from general corporate formation, partnership, real estate. We have a full-service litigation practice, and we also have a group of lawyers that handle bankruptcy and general insolvency matters.
We offer big firm experience with a small firm feel.
The person that you're hiring is the person who's going to be representing you throughout your entire map.
The slogan of redefining full service attempts to capture two things. One, an explanation of the breadth or the diversity of the legal services that we provide, but also to recognize that our service to our community does not end with our legal services.
Whether it's a pro bono opportunity where we're representing people for free, or whether we're actually volunteering on a project like Habitat for Humanity, for example.
It includes the philanthropic efforts, the volunteering of time, and the donating of resources outside just the four corners of this law office.
Okay, let's turn on all the mics, by the way. Let's get Roberts on as well. And, okay, excellent. Yeah, you're listening to KX93.5, Laguna's Only FM. I'm Scott Hayes here with my co-host, Robert Palmer. And, of course, Jill Harvey's in the room with us this morning as well.
She is indeed.
And this is Radio Caravan. And I'm honored to introduce our guest this morning, Dr. Lester Lee. He's one of the more distinguished Orange County doctors on anti-aging.
Thank you.
He has trained and treated professional and Olympic athletes. And he was recently featured, by the way, several times on the Real Housewives of Orange County.
Wow.
Wow.
Fantabulous.
But I think you said that gave you some pretty good exposure, did it not?
I suppose it did.
Yeah, I mean, that's a pretty good broadcast.
It
So.
depends on which woman you claim you help.
Yeah,
Yeah.
yeah, okay. Well, okay.
Some I would not bring up, yeah.
All right, well, we'll leave it at that. So we're not here today to talk about cardio and resistance training. We're not here to talk about nutrition or even conventional medicines, are we, Dr. Lee? We're here to talk about the anti-aging process. And it's a complicated arena. A lot of stuff's going on that's really outside the conventional medical fields.
True.
Therapies, procedures, stuff that's considered by many to be almost taboo. Testosterone therapy, hormone replacement therapy, stem cells, increased energy, improved sexual drive, improved immune systems, thicker and more supple skin, lower body fat. Do these therapies, I want to start with basically these therapies that we're going to be talking about, do they really work?
Yes, they do. Is that it?
Yeah, that's it.
Did
No,
you
you're
bring
welcome.
any of them with you? Because I could sure use some of those things.
Let me back up, yeah. Is aging a disease? Let's start there. Is aging a disease, and can we really slow down the aging process?
Aging is a natural process. However, there are ways we can modulate and retard. We can reverse a lot of the aging processes, the comorbidities that come along with the aging process by changes in our lifestyle, changes in our hormones, changes in our diets, changes in our overall sense of well-being, decreasing stress in our life. The field of medicine that is evolving for the past 7-8 years, regenerative medicine, incorporates a lot of more naturopathic, holistic processes that are not the way I was trained in conventional medicine years ago with just medication. So we're talking about processes that involve the whole person as an individual, responding to stresses in life, maturing as we go through the years. We cannot certainly reverse years, but certainly we have the ability to retard our aging process and feel good about ourselves before we die of something.
So can somebody do that naturally? I'm looking over here at Miss Jill Harvey for a moment, right? And can I share your age? Would that be, why don't you share your age with us, Jill?
I'm 80.
80 years old, and she looks great for 80, don't you think?
Remarkable.
She looks fabulous.
And look a day over 70.
I'll be 52 in a few weeks.
Yeah, so she'll be 52.
She's
and
still a youngster.
still a youngster in
Yeah.
many ways, but Jill sort of believes in the natural approach, do you not? Is that a
Yes,
fair way to
that's true.
describe
Yeah.
that? And is it possible if somebody really lives a healthy lifestyle like this, if they eat the right foods, if they do the right exercise, if they do all the things that we're supposed to do, that they can age gracefully without all these other sort of therapies and procedures?
Well, Jill, what do? You look fabulous.
Thank you.
You don't look a day over, okay?
Thank you. I appreciate that. I like the, yeah, thank you very much.
But in terms of,
Hello, girls
let's take
and boys.
example as
Today we're
Jill's
going to make-
lifestyle. Jill has a clean diet. She's healthy, she's attractive, she's vibrant, she has a great complexion, she appears comfortable, she feels relaxed. I'm not familiar with any kind of hormonal changes that's gone in her life or hormonal additions. When we think about hormones in men and women as we mature, as we age, we have deficiencies in all of our hormones. The hormones from female hormones, estrogen, progesterone, male hormones, testosterone, both for men and women, growth hormone, cortisol, thyroid, DHEA. DHEA stands for dihydroepiandrosterone, fancy term for a precursor hormone that makes testosterone and estrogen in men and women.
So men, they start to lose testosterone at what age?
They start losing testosterone after the age of 30s.
After the age of 30, and it just diminishes from there? It just keeps going down and down?
Decreases about 2% per year. In fact, I've seen a number of male patients over the decades. They were male menopause, best way to describe it, or andropause, the medical terminology,
Right.
when the testosterone levels are less than 300. Let's say normal levels are 300 to 100 when you see your doctor. He gets a blood test, and I've seen a fair number of 20, 30-year-olds with low levels. Now, a lot of that has to do because genetically, or diseases, or trauma, history of abuse of anabolic agents, opiates, pain medications suppress testosterone production. Alcohol suppresses testosterone production. So it depends, again, back to lifestyle. What has transpired in your past that can precipitate lowering testosterone in men and women?
If we're experiencing a lowering of testosterone in our systems, let's say, well, I'll use Robert and I as the example. Is there a testosterone therapy replacement procedure that we could go through that would increase our testosterone? And what sort of effect would that have on our well-being?
Well, let me start from the beginning. When I evaluate a patient, go through a history and physical examination, the questioning gives me the idea and tells me what hormones, not just testosterone, but let's touch upon testosterone, since that seems to be a big area of medicine, sports performance enhancement for men and women. Quite rampant in the past decades in my past history with Olympic teams as well as with patient athletes. Get a blood test, we look at the levels, we look at testosterone, we look at free testosterone, sex hormone binding globulin, natural protein in the blood that can bind up testosterone and makes it not available, even though you have adequate testosterone around. Usually symptoms that they present with, I'm getting increased belly fat, I have poor recovery, I have poor focus, poor memory, I'm having difficulty with sexual libido, I don't sleep as well, my skin is drier, I just don't feel like I felt when I was younger, assuming when you were younger you had adequate testosterone. So those are symptoms of low testosterone. For men, we call it andropause.
Right. So testosterone replacement, how's that work?
Different forms. Either one by rub-on gels.
Right. And those gels work? I've seen them advertised on TV all the time.
Yeah, you see the free tea advertisements quite often. They are very effective. They're absorbed through the skin. You apply them daily. Pellets. Pellets last 4 to 5 months. They're implanted in your hip area under local anesthesia. It takes about 15 minutes. Injectable, very common, especially more among, let's say, the athletes. And I have a fair number, well, several thousands of male patients who prefer the injectable because 100% is absorbed, whereas topically only 8 to 10% is absorbed, so it's not quite as predictable determining in terms of obtaining our peak levels. Oral form, I probably prescribe all of the above. I also prescribe and recommend sometimes it's more physiologic or natural HCG. HCG stands for human chorionic gonadotropin. We've heard about the HCG diet, low calorie, lose weight. In terms of for men, HCG stimulates the testicles to produce testosterone naturally, so potentially there are less side effects as compared to injectable and rub-on.
So let's talk about the side effects there, because if Robert and I were to go on some sort of testosterone replacement therapy program, we would notice all those sort of benefits that would be derived from having fair levels or higher levels of testosterone. But what are some of the side effects that might occur? Because I see some of the lawsuits that are going out there too about these, for example, the topicals and stuff.
Yes. Pros and cons.
Yeah.
In terms of side effects, potentially there can be loss, thinning of hair, increased acne, water retention, bloating, breast tenderness, increased coronary disease. The increased coronary disease is, my thought is, if it's abused and outside of recommended or prescribed limits, it can increase, just the opposite, increase your bad fats and increase your total cholesterol. Now, individuals who are low in testosterone, they also have a bad lipid picture. They have bad fats are too high, they have good fats are too low, and their total cholesterol can be higher because adequate testosterone is also important for metabolizing cholesterol. Increasing red blood cell formation long-term with testosterone, it's a positive thing, especially if you have somebody who's anemic. However, if you have too high a blood count, it thickens the blood like Pennzoil, makes you more prone to clotting events, heart attacks, and strokes. So those can potentially be downsides. And a good physician, let's say, would monitor those aspects a couple, 3 times a year to make sure that you're not having those problems.
Good point, by the way, that the black market testosterone area or arena is not necessarily the best approach for athletes or even men to go through to get their testosterone, but under the supervision of a medical doctor such as yourself, you have the ability to sort of monitor their levels and determine if you're giving them too much or too little. Is that sort of how you're advising people to go about that? What about women? What sort of similarities do they need if men are interested in testosterone? What about women?
Well, women, they're a little more complex.
Of course.
Thank you.
From a positive point of view.
Okay, good.
We're looking at more hormones in women. We're looking at estrogen, progesterone, testosterone also. We're looking at the cortisol levels, the stress hormone. We're looking at their thyroid. We're looking at pregnenolone. Pregnenolone is a precursor to other hormones in men and women. The balance of the symphony of these hormones are sometimes takes a little bit longer for women. But yes, the hormones and testosterone are very, very important for women also because it helps with bone hardening. It helps with memory and cognition.
Oh, okay.
It helps with the sexual libido. It helps with softening of skin. Testosterone converts to estrogen. Estrogen helps stimulate oil gland activity.
Oh.
Increased oil gland activity helps soften the skin. Overactive oil gland activity, we call that acne, zits.
Yeah.
So we may see individuals who are on anabolic agents on an abusive level but not doing it correctly. They have acne in their chest, their back. They may also have oilier skin. They may look bloated or puffy. So again, it's a fine balance for men and women.
Would you recommend everybody, if they had the resources, to go through some of these therapies we are talking about now and we're going to be talking about in a moment? Would you recommend that for everybody?
I would recommend that.
Yeah, why?
In fact, even starting at the ages of 30, not
Really?
40, 50, or 60.
Yeah.
Again, back to the concept of regenerative medicine, the anti-aging process, reversing some of the maladies that we see with the maturation process. Initial evaluation tells us about your overall well-being, assuming that the correct tests are ordered. So we're looking at inflammatory markers in your system, inflammatory markers for cancer, inflammatory markers for coronary disease. We're looking for deficiencies in your hormones, all the hormones, not just testosterone, estrogen, progesterone. The balance, again, the symphony, because they work well together. They work in symphony with the endocrine and neurotransmitters of the brain. Neurotransmitters of the brain is how Prozac and their families work. They stimulate things like serotonin, epinephrine, norepinephrine. And there's a balance between the neurotransmitters of the brain and the endocrine hormones. If one's out of whack, it throws the other one out of whack, and you feel wacky.
Yeah.
So the idea is to balance.
That's
both.
Robert.
Finally, I
The
now
idea is-
understand.
The idea is the balance.
So my thought is, I like to see individuals 30s,
Yeah.
depending on your genetic history, depending on what your parents, your aunts, uncles may have had, you may be predisposed to other underlying problems that you're not even aware of.
I played this club in El Centro one night and I ended up sleeping on the linoleum floor. At some point I got up and started writing a song. I wrote a bunch of stuff until I finally got a good line. And the next day I found myself at a street fair in Old Town, and I saw this beautiful girl wearing these turquoise earrings. I knew right then I had to put her in the song.
I've heard a lot about stem cell therapies. I have no
Yes.
idea what it is, how it works. I need somebody in layman's terms, Dr. Lee. Look me in the eye as I say
Yes.
that. In layman's terms, explain to me exactly what that is and how it works and why
Scott,
is it
you look very lay. Yes. So.
and why is that the cutting edge of the medical field these days?
It is one of the major forefront in the area of biotechnology and regenerative medicine. Stem cells are little baby cells, best way to describe it, that can differentiate, change into multiple kinds of tissues, from bone, muscle, ligaments, organ systems, kidney, heart tissue. Stem cells have been around for many, many years. It's a very expensive therapy. The idea behind stem cells is to, when we inject it, let's say into the vein, into the blood, it helps rejuvenate other organ systems. If we inject it into the shoulder, into a knee, it helps regenerate cartilage. The stem cells will latch onto tissue, mimic that tissue, develop a scaffold, and to grow new tissue around that area it latches onto.
That's amazing. I mean, that sounds like just an amazing process. Now, the stem cells, how does the procedure actually, help us visualize the procedure of that?
Well, I just did a procedure yesterday on a colleague. There are different ways. The most economical and least invasive way of stem cells is harvesting it from ourselves, called autologous from ourselves, because we're less likely to reject it because the body doesn't recognize it as a foreign protein, so we're not going to reject our own stem cells. We do a little mini liposuction around your belly fat. Takes about 25 to 45 minutes, depending on how much fat you have. The little machine that we have obtained spins the fat down. It separates out the stem cells. We harvest that stem cells, inject it back into face for rejuvenation of fibroblasts, collagen, elastin tissue, into the scalp to stimulate hair growth, inject it into knees, shoulders, elbows, ankles. If you have a degenerative process, it helps regenerate cartilage. It has an anti-inflammatory effect. We shoot it into the vein. That circulates throughout the body, and what it has is a positive modulation to boost the immune system. It recognizes the organ system that it has transferred to and helps regenerate that tissue.
Now, this surprises me. So if I were to take my own stem cells and inject them into my scalp, if I were having a receding hairline that might regenerate the hair growth? Is that what you're suggesting?
Correct.
If I injected it into my face, I would have a more supple-looking face as a result of that stem cell therapy?
Correct.
And this is like medical records. This is on the books. Everybody knows this works.
Yes. In fact, there are a fair number of dermatologists, plastic surgeons throughout the United States who have for a number of years already been doing that.
Why would people go through a facelift or any of that sort of stuff if they can just take their own stem cells and inject them and have sort of a similar response?
Well, cosmetically, for an invasive procedure, again, stem cells have a limitation in terms of wrinkles. If you just look like Deputy Dog in a Shar-Pei, stem cells
That's Robert and I.
That's going to be probably a little more invasive process to remove excess tissue and skin. The stem cells are very commonly utilized with the cosmetic surgeon to continue to complement the quality of the skin. So the best way to describe that is stem cells increase the quality of your skin, let's say after you've had it altered or you've had it cosmetically changed and restructured.
Let's say Robert has a bad back, okay? And let's say we take some of his stem cells, we spin it in the machine, we pull out those healthy stem cells and inject it into his lower back. Is that going to repair his back?
It's not necessarily going to repair the back. If you have some degenerative process in your spine, we inject stem cells into the muscles or into the bony area. Again, it will latch on, recognize the tissue, form a scaffold, and form and help new tissue. So it significantly decreases pain. Is it going to cure the degenerative process? No.
Where does the FDA stand on this?
FDA, Food Drug Administration. The question comes up quite often. The FDA does not necessarily sanction stem cell treatment. Again, they are not opposed to it too. In the United States, we can go ahead and receive our own blood, spin it out, the stem cells, or fat tissue, mesenchymal stem cells, and inject back into our cells within 24 hours. We cannot bank the cells and use it for later. Therefore, a fair number of individuals go to foreign countries because those are out, they're not governed by the same laws.
Right.
Yeah.
So here in the U.S., yes, you can use your own, but not somebody else's cells.
Yeah. Do you have a comment,
I
Joe?
totally believe in stem cell. That's something I think is very exciting and very cutting edge. And I have a friend who went to China and had it done, and
Yes.
she is over 70. I kid you not. She probably looks her late 40s to 50. She had it put under the skin and then into her own bloodstream. Phenomenal.
Did you see her before and then you
Yes.
saw her after? And you're
Yes.
saying you noticed a dramatic result of
Yeah.
the stem cell therapy.
Yeah, and I think, like Doctor was saying, if you take it from your own tissue and you're putting it in a centrifuge, your body's going to accept it.
Right.
It's nothing foreign. It's not synthetic.
Correct.
So I'm really excited. I think this is something.
Have you
super
ever
exciting.
tried it?
I have not.
No. You're going to try it soon, yes, Dr. Lee?
I am going to be my own recipient, my own stem cells on July 31st in Dr. John Laura's office. We've performed over 20 of these procedures since March. Phenomenal results. People who have diabetes, we lower their sugar, we lower their glycohemoglobin, which is a measurement control of their sugar, by multiple folds. People will have autoimmune disorders, colitis, who wake up every morning with abdominal pain. After the injections intravenously, the pain virtually disappears on a fair number of these people after a month. People have migraine headaches. Individuals who have rheumatoid, again, autoimmune disorders. People have depression, autism. Again, the literature is very strong, the medical literature is very strong in benefits of the, again, stem cells from yourself.
It almost rings a little bit of Frankensteinian, you know, this sort of mad doctor in his, his big tower on the hill.
There's no lightning involved.
Yeah, no lightning involved, but something pretty close to it. We got about 1 minute left, Dr. Lee, maybe two. But it kind of feels that way, but I suspect any new technology or therapies that come out in the medical field in the beginning feel that way. Wouldn't you agree?
I agree.
Yeah.
And again, stem cells is not a novel new idea.
Yeah.
It's just that in the United States, one, it's cost prohibitive. It can be $8,000 to $10,000 or more.
Wow.
Insurance companies don't cover it.
Right.
And it is a very simple procedure.
Yeah.
It is not really painful. It's like a mini liposuction from your own belly fat. And it takes all about 25 to 35 minutes. And then the machine does all the work. It
Right.
spins down the cells. It's the quality of the machine, actually, that determines the quality of your stem cells that you're injecting.
Excellent. We got 1 minute left. Let me ask you about cost. You mentioned the stem cell therapies. Orange County is an affluent community. Certainly there are people who can afford this type of therapies, yes?
Most people here in Orange County do have jobs.
Testosterone therapy, hormone replacement therapy, these stem cell therapies, et cetera, $8,000 to $10,000 range per. How's that work?
Well, for, again, stem cells, the initial harvesting is about $8,000 to $10,000, and then injection into different body parts that you desire, as well as intravenously for overall rejuvenation. If you bank your fat, and there are companies around the United States will bank your fat. You cannot bank your own stem cells according to FDA regulations, but you can bank the fat. So if you bank your fat and you want a chunk of it, let's say, a few ounces of it later, you have it FedExed, you thaw it out, the machine spins it down, you inject it in yourself, so it's very, very not very invasive.
Is this something I kind of have to constantly do? Is this something I'm going to have to go through every year and spend this money to go through this sort of these sorts of therapies?
If it's just for overall health and you don't have any specific, say, pathologies or diagnoses, once a year. If you have, say, an autoimmune disorder or you have some kind of degenerative neurologic disorder, it's probably going to be more in the order of 3, 4, 5 times a year.
Interesting. Robert, would you consider this sort of these sorts of therapies at all?
I would.
Yeah. Have you done any of them?
I have not.
Yeah. And so now that you've heard Dr. Lee, testosterone therapy maybe for you, maybe a little stem cell injection?
Why would you say testosterone?
Would you consider it, though?
I think the stem cell is fascinating.
Yeah.
Absolutely. I've been following it since it came out. It's absolutely fascinating.
Excellent. Yeah. Hey, Dr. Lee, thank you so much.
Thank you very much.